I want to start with this question. Why is it so hard to change what we eat, even when we know what's good for us? In the United States, people living in rural areas experience a higher rate of diet-related chronic diseases, including cardiovascular disease, and also these communities face greater health disparities, including less access to healthcare and preventive services. And at the same time, plant-based diets have been shown to improve health and reduce diet-related environmental impact. But if the benefits are so clear, what is still holding people back? So this study looked beyond personal decision-making and focuses on social environments. In this study, we looked at different aspects of social relationships. And first we analyzed a national survey from rural residents, and we looked at different aspects of social norms and adherence to plant-based diets. Based on this study, people who had a plant-based diet were more likely to be younger women and to have a higher level of education. The strongest predictor of plant-based diet adherence was perceived influence from important people. In fact, people who agreed more to this statement, that people who are important to me think that I should follow a plant-based diet, had almost 3 times higher probability of doing so. But for perceived social pressure, it was not the same. After stratifying for genders, for men, we found that social pressure has an association with a lower adherence to plant-based diet, but for women, it didn't influence their behavior. Then we conducted semi-structured interviews with rural residents to study their lived experiences. Many participants talked about how deeply their food and diet is tied to their relationships with others. People who had plant-based diet mentioned more often about having support from their immediate family members, including shared meals, shared values, and encouragement from their partners. And also people who had plant-based diet mentioned that close relationships like friends are also important to have their support. And it was very interesting to see how men and women faced different support from their immediate family members. For men, they were more likely to rely on their immediate family members' support to sustain a plant-based diet, but for women, they faced more resistance, especially from their husbands, which is not a surprise, sorry. But all of these data reminds us that having a dietary behavior is not just a single individual decision, it's shaped by our relationships. And we should all remember that what we eat is not only about the food, but it's about the people who we share it with. Thank you.